Dear students, what do we cover in one day in ECG? A very serious question asked by many students. It is not at all a serious question, it's a very simple question. Dear student, do remember ECG is a very simple thing, it's just a mathematics. And once you know the basics of ECG, then you can diagnose many things by using ECG. In one day ECG, my purpose is to make you eligible to read the ECG which you require regularly in the OPD and in emergency in the beginning of a ICU. We practically start with the myocardial cell, the concept of depolarization and the concept of repolarization. Then we see how the PQRST develops. Then we go into detail of the machine, how machine works, and what is the speed of the machine, what are the calculation of the strip. I can tell you very simply that a smallest square in the ECG strip is represented by 0.04 seconds. I will teach you in detail how, from where this 0.04 second comes. Then we go with the different interval, the the PR interval, the QRS complex, and then the QT interval, their significance, their normality. Then we go with the details of the leads, the unipolar leads, the bipolar leads, the vertical lead, horizontal leads, how to apply the leads, how they look at the heart, the different looking directions, that is the anterior part of the heart, the inferior part of the heart, the lateral aspect of the heart, all these, where they are reflected, in which lead it is reflected. Naturally, the disease of the right side will be reflected in those particular leads. And at the end, we see how we can make the ECG. This is the first session. In the second session, there are three topics. One, how QRS complex is produced. How the QRS complex is produced in the lead V1 and V6, that is extreme right and extreme left. It is having clinical significance in LVH and RVH. Secondly, in that we cover the heart blocks. In heart block, we cover first degree, the different types of the second degree heart block, the third degree heart block. And I give you some idea regarding what you need to do when you find out this heart block. And the last topic which we discuss in this session, in this part, is cardiac axis. Normal cardiac axis, the right axis deviation, and the clinical condition in which you need to go with the right axis deviation, and the clinical conditions in which you need to go with the right axis deviation. I don't teach you ECG only, I teach you the clinical condition in which you will find those changes. The third session starts with the chamber hypertrophies, the right atrial hypertrophy, the left atrial hypertrophy. Then the ventricular hypertrophy is right ventricular hypertrophy, left ventricular hypertrophy. Naturally, there are clinical implications. In which disease you will find left ventricular hypertrophy, in which disease you will find right ventricular hypertrophy commonly. And then the details of them. Then we go with the details of IHD, ischemic heart disease, the different types, the different form of ST depression, that is downsloping, depression of the J point, and so many things we discuss with the IHD. Then we discuss acute myocardial infarction, what are the changes in the ST, T wave, how the Q waves are formed, what are the details of it, how to see it in the ECG. I will show you so many cases, so many ECGs of the different patients where you will find ST elevation, the changes in the T wave, and how the patient recovered, and what remains at the end, that is the Q wave remains at the end, and that is what we say that in the old ECG you will find only old MI you will find Q waves. And so many things we discussed. And the last topic I discussed naturally in the third session was related with electrolytes. And in the fourth session, we actually take a write-up of the important things what we have seen in the since the morning. And at the end, we will go with the practical. So what is the practical? What is the practical? Practical is nothing but we take a volunteer, we make his ECG and make you eligible to see whether it is a normal ECG and whether it's abnormal ECG. If it is abnormal, then the clinical condition related, the ECG condition related with it, I will tell you about the patterns of the ECG, and so many things we'll discuss. The session starts by 8 o'clock in the morning. Every session is of 2.5 hours, 3 sessions, and the last session is say of 1 hour of writing and 1.5 hour or 2 hours of the practical. And this is how the session starts by 8 o'clock in the morning and generally ends at 6:30 or 7 o'clock in the evening. But I will give guarantee that every student will understand it. It's likely to be a guarantee. Almost every student will understand. Yes, there are some students who don't want to understand and those who will not understand. But if you know that the heart is having 4 chambers, I will tell you that yes, you will be the happiest person reading ECG, knowing ECG. And it's a doorstep to enter the hospital practice. Once you know, dear student, do remember, once you know the ECG, you can enter the hospital, you can work there, and you will be treated as a respected person because you know the ECG. And that's why I always ask my student to go for ECG, one day ECG. And it's really a fantastic one day. You will get the 4-color printed note. All papers are glossy papers so that you can understand each and every minute change in the ECG. And really it's a wonderful topic for you. This is what I tell you about ECG.